audience members. My name is Dusa Lopez, and the title of my speech today is Vaccines and Infectious Diseases. It was during one of my hospital clinicals that I first encountered the devastating effects of infectious disease. I was assigned to a patient that was paralyzed from the neck down. After conversing with her, I learned that she had contracted polio at a young age. She conveyed to me how hard it was for her family to take care of her and how hard it was for her to obtain an education. I couldn't imagine living her life. Thankfully, to the medical advance of vaccines, polio is now nearly eradicated. But people have become so comfortable that now the effectiveness of vaccines is being contested. According to the Healthy People 2020 goals, the CDC and the National Institutes of Health, more than 42,000 people die each year of vaccine-preventable diseases. As a member of the United States of America, you should know the importance of vaccinating to prevent disease. Let's go over what a vaccine is, what are some of the diseases that can prevent us from, and why it is our responsibility to one another to get vaccinated. Vaccinations help our immunity fight against diseases, and they are safe. Vaccinations are an imitation of infection introduced to the body to stimulate your immune system to create antibodies to fight against an infection when you come in contact with it. This is a powerful tool because you never actually get the symptoms of the disease. Some adverse effects do occur. According to the Center for Disease Control and Prevention, around 30,000 reports of adverse effects from vaccines are reported, but only 10 to 15% of those are serious. And often, it is because a person is allergic to one of the ingredients, not the vaccine as a whole. Most side effects are mild and include soreness at the site or fever, and these subside after 3 days. Although vaccines are safe, some myths have developed. One myth parents believe is that vaccines cause autism. However, this is not true. In a study published by the Journal of Pediatrics and led by Dr. Frank DiStefano in 2013, 256 children with autism were compared to 752 control children to determine if there was an association, and there was not. Vaccines are safe for children and for all of us. Now let's move on to infectious diseases that immunization can affect you from today. As adults, especially those of us that are in college, the meningitis vaccine is an important vaccine for us to get. Meningitis is the infection of the membrane surrounding the brain and spinal cord. The disease can spread by just a cough or a sneeze. So if you are going to be in a crowded area, you should get vaccinated. According to a study published in the New England Journal of Medicine led by Dr. Michael Thigpen, titled Bacterial Meningitis in the United States, 1998 to 2007, the current vaccinations prove to be appropriate for preventing meningitis and causing the decline of the disease. So this goes to show that vaccines are still doing what they're supposed to be doing. Another infectious disease you might not have considered is the flu, but it can be deadly. In 2011, it killed more than 50,000 people, according to the National Vital Statistics Report. However, in the 2013-2014 flu season, less than half of Americans were vaccinated. This just shows how much we can improve. Lastly, vaccinations are a national issue that we must all work on to keep each other healthy. Infectious diseases spread quickly. Droplets in the air can spread the flu, they can spread meningitis, and pertussis. Some diseases, such as tuberculosis and measles, are spread just by the air, and the only way to protect yourself is using a mask with a respirator. So once these deadly diseases start, it's hard to stop them. Also, it's usually not me or you that die from these diseases, but it's the children and the older people that do. Children who are not vaccinated are at a higher risk for contracting disease. According to a recent article published in the periodical Contemporary Pediatrics in 2010, 58% of children that survived meningitis had a standardized disability. So even if they survived the disease, they could have missing limbs or cognitive defects. Older adults whose immune systems are weak and cannot live through this disease, it's estimated by the CDC that 90% of deaths related to the flu are people over the age of 65. So it is our duty and responsibility to protect the young and the old. I have shared with you how a vaccine works, some diseases that it can protect you and me from now, and how it is our responsibility to our society to get vaccinated. The patient I cared for could not have escaped the effects from her polio. We cannot afford to go back to a time when patients live in fear that parents live in fear that their children will not live past age 7. We all must get vaccinated, and if we choose not to, it could have detrimental effects on a national level. Let's work together and keep the United States a safe place to live. By audience members.